Welcome to the neutral pelvis module. Now, this is a very crucial component of any kind of movement within the gym, really having control over our pelvis and having a look at what a neutral spine is, why we need that, and so on and so forth. So, let's jump into it. We have the neutral spine. So, the definition is pretty simple. A neutral spine is the position in which your back and your neck are placed under the least amount of stress and strain. So, it's allowing them to function properly without damage to the tissue and therefore without pain. So, in this diagram, you're going to really see the different positionings of the pelvis. And even as you're listening to this, if you're standing or if you're seated, I really just want you to take note of your positioning as you're standing there. Are you in more of an anterior pelvic tilt? So this is where your pelvis tilts forward. And just rest assured, if you're not quite sure yet, don't worry, I've got some more information to help you out. Then we have a posterior pelvic tilt. This is where our pelvis is tilted backwards, and we can see that we're flared here. And then we might have a forward shifted pelvis where we're going to really cause that sway back. So we can see that the pelvis is just kind of in a relatively kind of neutral position if we're looking here, but we can see that, our hip bones are really pushed forward and we're creating that sway in the back. We can see obviously our hip joints hyperextended, our knee joints hyperextended, our torso shifts towards the back to compensate, and this can put a lot of stress and pressure on our lower back. If we think about, pregnant women, or if you have a lot of fat around the midsection of your body, this can also put some pressure here and cause a lot of issues if not looked at. And then we have the neutral pelvic tilt or balanced posture. So we can see here that the pelvis is in a neutral position. Our spine has a natural curvature, but we're not tilted backwards. We're not tilted forwards. We're just in an upright, stacked position. So to find a neutral spine when you're training, it's very simple. So we want to align and stack our pelvis, our rib cage, and our head to the torso angle that your move requires. So if we're thinking about an RDL or a hinging movement, our whole torso is going to come forward. We still need to maintain this neutral spine position and positioning as we are moving through the movement. So again, looking at this diagram here, if we have a look at the rib over hips, if we have a look at our rib flared, so we can see that's an anterior tilt, tilted forward. If our ribs are flared this way and, we're tilted back, and then obviously we can see that, again, this is like an overarch through that upper back, but you can see a couple of different variations. This one here, this first one's that correct one. The pelvic floor switched on, the diaphragm is down, everything is stacked and locked in. Our TA, our transverse abdominis, is working nicely. That's the one that runs along the front of the spine. So again, I'm going to show you in practice. I want you to sit or stand or wherever. And we're going to practice stacking our rib cage over our hips. And this is crucial when it comes to our movements overall, and ensuring that when, maintain health and integrity of our bodies, like we're with them for life. So stacking your rib cages over your hips in practice. You're either going to stand or sit on an exercise ball. You can also sit on a chair or anything like that if you need to as well. And now what you're going to do is you're going to place your hands on either side of your hips. So you want to place your index and your middle finger on the front of your hip, that top bony part. Maybe when you're at the beach sunbaking, you can kind of see those hip bones. You might be able to see them now. Obviously, this is very dependent on genetics, but you're going to place your fingers on the front of that hip, the index in the middle. Now you're going to place your thumbs on the side of your hips. So basically, you just want to feel the top of your pelvis, okay? So you're going to put your thumbs there. So now what you're going to do is you're going to move through anterior pelvic tilt, posterior pelvic tilt, and then you're going to find that neutral pelvis, which is in between. So keeping your hands there, an anterior tilt is where your hip bones tilt forward. So where your index and your middle fingers are, we're going to feel that tilt forward. So I want you to tilt that position forward. You should feel that your thumbs are a little bit higher, your index and your middle fingers a little bit lower. So now we're going to move into posterior tilt. And again, if you're seated, you're going to feel movement. If you're standing, maybe look in a mirror and have a look as well, or record yourself. The posterior tilt, we're now going to tilt our hip bones backwards. So where our index and our middle finger is, our that part of the pelvis is going to tilt sort of upwards and back. And those thumbs are going to go down. So we're going to slowly tilt our pelvis forward as far as it allows. So your spine, so again, moving into anterior tilt, we're going to tilt it as far forward. Your spine's going to increase its natural curve. So you're going to feel that big, curve increase. And then now we're going to slowly again tilt our pelvis back as far as it allows. And it may feel like you're actually tucking your tailbone underneath, or you're shortening the space between your ribs and your hips, and you're tilting it. You want to go all the way as far as you can in either position. So you really want to find your limits of like, how far can you go into anterior tilt? How far can you go into posterior tilt? And so now that we've found our end ranges, and pause this video and take some more time to move through this if you like. Again, it takes about 10,000 repetitions for us to understand, within our brain and create those new pathways to remember movements. So it's going to be a work in progress. But now that we've found our end range in anterior and posterior tilt, we're going to keep performing a few more reps. And once we're comfortable, we're now going to find that neutral pelvis, which is actually in between. So the neutral pelvis is the middle of your full anterior tilt and your full posterior tilt. It's the position where your ribs sit over your hips. So really take your time to find that positioning. And once we've found that positioning, I really want you to take notice, either take a photo or take a video of yourself, whatever it may be, because this neutral pelvis is the one that should be maintained throughout movements. And if we nail this, we can definitely say ciao to back pain. So even if we're looking at, an RDL, so a Romanian deadlift, where we're hinging at the hips, maybe we're looking at a squat, we still want to keep this neutral pelvis and neutral spine. You'll hear me refer to neutral spine a lot. And I really want you to think about, neutral spine in pretty much most movements. If you're setting up for a dumbbell row, you're pulling that off the floor, your positioning, you need to have a neutral spine and set yourself up. So it's really, really crucial and the foundation to all of these movements. Remember, Rome wasn't built in a day, but they did continue to lay bricks. So keep practicing and you will get there.